Welcome to Healthcare Intelligence. I'm your host, Matt Meyer, and this podcast is brought to you by Telligen, where we strive every day to help people live their healthiest lives. You can learn more about us and our services at telligen.com. Today, we're doing a deep dive into transitional case management. This is an area of healthcare that has been getting a lot of attention, thanks to individuals like our guest today, who understand that transitioning between care settings, like a hospital to a nursing facility, is a crucial time when patient safety is at an all-time risk. That's why case managers are so important for ensuring that everyone involved in the member's care follow that same person-centered plan, ensuring that members' needs are front and center. This not only leads to higher member satisfaction, but it has been shown to reduce the burden on our providers and manage costs better. I think anyone who has experienced a friend, a loved one going through a major health event involving moving from one location to another care setting, knows how big of a topic this really is. And that's why I'm very excited to be here to talk about it with today's guest, Stefanie Timerson. Stefanie is the manager of quality improvement at Telligen and is a transitional care nurse who has worked with patients in case management for more than 6 years. Having previously worked as a case manager for home health and wound care, Stefanie is based out of the great state of Oklahoma and is also a rock star mother to 6 kids. Welcome to the podcast, Stefanie. Thank you for joining us. Excited to have you here.
Thank you. I'm excited to be here too.
Perfect. All right. Well, now's an opportunity for us to get to know you a little bit better. Maybe you can give us a little bit about your career journey, your hobbies, anything outside of Telligen you want to share.
Yeah, absolutely. So I'm born and raised in Oklahoma. I'm married to my wonderful husband, Jason, and we are proud parents of our 6 children, and we also have 2 grandchildren. I'm a registered nurse whose journey took an unconventional path. I decided early on that I would wait until my children were school-aged before I would pursue my nursing degree. The Army had brought us to Fort Drum, New York, and so I attended one of New York's top nursing programs where I excelled academically, and I served as president of the Student Nurses Association. Following my husband's retirement from the Army, we relocated back to Oklahoma, and that's when my nursing career began. I started out as a case manager at a home health company. I had a short stint at the hospital doing same-day surgery, but I came back to my true love of case management and worked at a wound care center for a few years. In 2022, I joined Telligen, and that's where my career truly flourished. I started out as a health coach, and then I advanced to a transitional care health coach. And then in September of 2024, I was promoted to quality improvement manager overseeing the transitions of care team. And I would just like to say that Telligen has been an incredible blessing for my career. I have had the opportunity of working alongside some exceptional colleagues, mentors, and leaders. And so here's a shout out for my team. I am so proud of you guys, and I'm excited to see where the future brings our transitions of care team. Outside of work, my hobbies include I go to church. I love church. I love to go hiking and cooking. And most importantly, I love spending time with my family.
Oh, that's great. Wonderful. Well, thank you for the important work you're doing as a nurse, the work you're doing in the Medicaid space and really helping address needs in that really vulnerable population. I'm super excited to have you with us and just to learn more about transitional case management and the important work you're doing. So I thought we could start by your work primarily with the Oklahoma Sooner Care Health Management Program, or HMP, as we often call it. And because we're going to talk about that, I'd love to learn more about the work that you're doing for the Oklahoma Sooner Care HMP program. What is it? How is it helping those members? What does your team look like? What is that impact that you guys are having in Oklahoma?
Certainly. The Oklahoma Sooner Care Health Management Program helps with people with chronic conditions across the entire state. What makes our program unique is that we work at a community level. We have team members throughout all 77 counties connecting directly with patients and their local healthcare providers. We focus on improving health outcomes through personalized care management while keeping Medicaid cost manageable for our state.
Terrific. Great. All right. Well, now let's talk about transitional case management. For our listeners, some may be very familiar with case management, others might not. But when we talk about transitional care management, what does it look like for a company like Telligen? What is it that they're helping with in that transitional care case management space?
Of course. Transitions of care is a scope of practice that focuses on ensuring continuity of care to our members who move between different healthcare settings, as well as when they return home. At the Oklahoma H&P, we focus on ensuring that our Medicaid members have a seamless care coordination across all healthcare settings. We serve as advocates to each member, which could look different. It could mean performing home visits to do some additional education. It could mean provider follow-up support by scheduling these appointments for the members or attending the appointments with the members as an advocate. We focus on early intervention. We want to identify any barriers and reduce those gaps in care that often lead to a readmission. And we aim to improve overall health outcomes through comprehensive support during those critical transition periods.
So you could be talking about a individual who's transitioning from a hospital setting where they've got around-the-clock care to a different facility, or even returning home. And I can imagine the types of services that they're getting is different. The providers that they might be working with is different. So managing that transition is key to success, or really kind of avoiding further complications or acute injuries after that transition.
Yes. Some of the barriers that we've seen, firsthand experience as being a former transitional care health coach is a lot of the members that we engage with don't even have a provider. So that early intervention matters, and getting them established with a provider and getting their follow-up scheduled within 30 days of their discharge.
Got it. And I think you mentioned the plan that's put together is very unique to each individual, patient-centered, as we like to say. You don't see, no two cases or members are the same.
Absolutely not.
Wow. Yeah. Perfect. All right. Well, so next question. I want to talk about how those partnerships with hospitals, how important are those hospital partnerships and the increase in transitional health coaches contribute to that effectiveness of care, or the customization of that care for each of those members?
Yeah. So expanding our hospital partnerships and having more of our health coaches trained in the transitions to care process, it allows for us to have care coordination with these members across a wider range of our state. So we have some of our transitional care health coaches that are actually embedded in some of Oklahoma's premier healthcare institutions. And with them being embedded in those hospitals, we're able to access real-time patient information to better assist them in their post-discharge care. We also have transitional care health coaches working remotely, reaching members throughout the entire state. As we continue to grow and build our hospital partnerships and have more of our health coaches trained in the transitions of care process, we have the ability to manage more complex, high-risk members across the entire state.
Got it. So you mentioned some of those transitional care nurses are embedded at the hospital, and some are doing this work remotely.
Yes. So the ones that are embedded, they, go up to the hospital maybe like once or twice a week to, collaborate with the case management staff, meet those members face to face. So when they go home, they know who's going to be calling them to follow them for their post-discharge care. Great.
So really finding the right path or right platform to support those members, whether it's remote or in person.
Yes.
Great. So you mentioned training for those nurses. How important is and how does it contribute to quality certification for those nurses in transitional case management?
Yeah. So at our Oklahoma H&P right now, we have about 50% of our health coaches that are case management certified, and we're working towards that 100% goal of having all health coaches case management certified. Having a case management certification enhances our professional credibility. It ensures that our health coaches have standardized, up-to-date knowledge. And with that knowledge and expertise in case management, this would lead to better outcomes for our members and cost savings for our client.
Got it. And what are some of the tools that are available to those case management nurses to really help improve that quality of care for those
Yeah.
members?
Recently, one of my staff partnered up with marketing and they created a hospital infographic flyer. And we use this tool to educate members on appropriate emergency room use. Some of our members, they have a lower literacy level, and it's important that we're able to meet them where they are and educate them on a level that they understand. And this is key to reducing readmissions. And actually, just yesterday, I had one of my health coaches reach out to me with a success story of the infographic flyer. She said that she's been working with an adult member who is cognitively delayed, and she can't read or write, but she was able to look at the pictures from the infographic flyer and understand the difference between going to the emergency room versus urgent care.
Oh, that's great.
Yeah.
Yeah, that's a great example of kind of
Yeah.
meeting those members where they are. It's one thing to work from a script or a process when
Yeah.
you're meeting with those members, but if they can't process what they're being told, you've got to find a way. You've got to find a way to an intervention to get them on the
Yes.
path to make sure it's clear, concise, and they're on board with that program.
We also have a personal health record that we mail out upon engagement to each member. And this tool allows our members to stay up to date with their health management. As you know, we work with high-risk, complex members. So some of these members don't only have a primary care physician. They have the primary care physician with multiple specialists. So we send out this form, and it entails, they can list their medications, they can list their providers, their diagnoses, their allergies, when their follow-ups are. And they can take this paper with them to each follow-up and update it as they go. So if there's any medication changes, they'll be aware and be able to self-manage better.
So that's probably part of the onboarding process with a lot of these transitional case management nurses is understanding just the scope and the depth of the providers that they're working with, and
Yes.
trying to make sure that care is coordinated across all of those providers. And I can imagine just keeping an understanding of all the medication that they're on takes a lot of coordination as well.
Yes, it does. They perform medication reconciliations at each member contact to make sure the member understands their medications, that they're compliant with them.
Got it. Let's talk about data. How does the Oklahoma Health Management Program plan to leverage data collection and analysis to drive improvement in the Transitions of Care program?
Yeah, so my colleague Julia has an internal performance tracking system in which she sends out a quality assurance report to each health coach monthly. This report evaluates their performance and it identifies areas for improvement. For Transitions of Care, we focus on if the health coach is following the NCQA documentation guidelines. Are they following the provider follow-up requirements? Are the care plans patient-centered and individualized for each member? Are they performing those medication reconciliations? Are they documenting labs? Are they collaborating with providers and the case management staff to get all the information for the member? We also monitor readmission rates and see where we can improve on that. The national benchmark for Medicaid members is 9.8%. And at our H&P, our program goal is to stay below that national benchmark of 9.8%. We also follow and track successful provider follow-up rates. And our competitor in the fourth quarter of 2024, which is members who are not engaged in our program, that's our competitors. Their successful provider follow-up rate for the fourth quarter was 63%. And at the Oklahoma H&P, our successful provider follow-up rate for 2024 was 79.6.
Wow.
Yeah. And we also value our member survey results that we get quarterly. I think it's important to hear from our members. How are we successful in serving them, or what areas can we improve on?
Got it. So that data is a great way for you to kind of measure the effectiveness of your team, identify gaps,
Yes.
like you mentioned. I assume it's also very valuable information for the state of Oklahoma.
Yeah.
I mean, they can see really in black and white the difference that the HMP program is having and just how effective it is.
Yeah, we report monthly our data to our client.
Well, perfect. So I want to talk a little bit more about that patient-centered approach. So when you're working with a member or an individual, building care plans, working on that transition of care, you're not only working with that individual member, but oftentimes family members, extended family members. What does that relationship look like beyond just the member or the patient? How do you communicate with those family members? How do you kind of get everyone on board and aligned with what the plan is for that individual?
Right. We empower, we listen, and we do what we say we're going to do. And by empowering, I mean educating. We want to educate these members to be able to self manage, and we want to provide them those tools to make them be successful in their health management. We listen to them. Listening plays a huge part in building that relationship and trust with the members or their family members. Sometimes these members don't have a solid support system at home, and our health coaches are the only contact that they have through the week. And
Yeah.
sometimes they just want someone to listen to them. They're not feeling well. They're scared. They want someone to reassure them. They want someone to address those questions and concerns that they have about their hospital stay. And unfortunately, we have had some members, that have told us that they feel discriminated against due to their Medicaid benefits or from things from their past. So it's important that we listen to them and reassure them that they are worthy of quality health care. And that's what we're here to do, is provide quality health care to them.
Oh, that's great. Yeah, and that can be, there often are so many extenuating circumstances that go into that Medicaid population, getting them the care that they need, the transportation, all of those things. And as you mentioned earlier, it's very individualized or customized because no two members are alike, and their care plans are not alike. I imagine your team has a lot of wonderful success stories to share, a lot of wins where they've really encountered a case or a member that had a particularly unique or challenging experience that you had to really help guide them through and connect them with the care that they needed.
Yeah. I have a couple off the top of my head that I could share with you.
That'd be great.
We had a member who was a high ER utilizer due to unmanaged pain, and she didn't have a primary care physician to follow her. And she also needed food assistance, housing assistance, transportation assistance. And so that transitional care health coach collaborated with our internal resource management team, and they were able to locate a list of providers for that member in her area and were able to schedule her an appointment within the 30 days of her discharge. They were also able to arrange her transportation to that initial appointment. The member attended her appointment and was very pleased with her new provider, who promptly got her a referral with pain management. And during her time at TOC, Transitions of Care, she attended all of her appointments with her provider and her specialist, and she had no ER visits. And that member reported an overall improved quality of life and health, and she was sincerely grateful for the care that she had received from the Oklahoma H&P. And I'd also like to add that our resource management team was also able to get her partnered up with a local food bank, and they were able to start delivering food to her home. And they assisted her on filling out the paperwork for Section 8 housing for a duplex, aged 55 and up. That's really what she was wanting to do. So it was a huge success. She was grateful, and we're just very happy that we were able to serve her the way we did.
Oh, that's great.
Yeah.
Yeah, I can imagine oftentimes it's not about just connecting a member with the right provider or getting them on the right medication. It's that holistic approach, as you mentioned, the transportation, the food bank, all of those basic needs need to be addressed. Otherwise, I'm assuming the risk only increases to see that population in the emergency rooms.
Yeah.
Having acute episodes that could be avoided, that are being avoided by the services that you and your team are providing.
Exactly. We have a member who was in the emergency room twice for diabetic ketoacidosis. And this member was actually eager to begin doing her self-management with her diabetes, but she was struggling with frequent blood sugar checks due to her high blood sugar. And what ended up happening is she was getting low on her supplies, and she eventually ran out, and she was running low on her insulin. So the member called her pharmacy, and they informed her that she wouldn't be able to fill her supplies for her glucometer or her insulin for another 3 weeks. So the Transitions to Care health coach reached out to the provider office, and they were able to get her a continuous glucose monitoring device. It's called a Dexcom, and insulin samples the same day.
Wow.
Yeah.
Yeah. And with a condition like diabetes, that care is just not something that you can wait on.
Yeah.
You can't say, oh, we'll get to you in a couple weeks. I mean, there's an urgency there that is vital to keeping those folks connecting them with the care that they need and reducing the risk of really serious things happening.
Yes. Working with this member, she was attending all of her follow-up appointments, and during her time of transitions of care, she didn't have any more emergency room visits either.
Wow. Oh, that's incredible. Well, great. Well, this has been really exciting for me. I've enjoyed this. I've learned so much more about not just transitional case management, but the important work that you and your team are doing in Oklahoma and helping that very vulnerable population. So
Yes.
thank you for sharing a bit about it. I know I am more familiar with it now and just appreciate the difference that you're making in Oklahoma. So thank you, Stefanie, for joining us and for sharing those stories and helping us learn a little bit more about that program.
Thank you for having me. I really enjoyed being here.
Well, and thank you to everyone for listening. We hope this conversation has been insightful and educational. This podcast was recorded at Trilux Studio with Brooke Schaffner Engineering. Producers for this episode are Tammy Lichtenberg and Chris English. Copyright 2025, Telligen, Inc., all rights reserved. If you have any questions or would like to know more about Telligen, please visit our website at telligen.com. And stay tuned for our next episode coming your way very soon.